Ebola is back in the Eastern Democratic Republic of Congo. A deadly virus, conflict zones, fragile hospitals, funding cuts. On paper, this should be a disaster. And yet, African health workers have done something remarkable for nearly 50 years. They've repeatedly stopped Ebola outbreaks from spiraling into global catastrophes.
C'est un dispositif pour faire le tri des malades. Chaque fois que nous avons des patients qui viennent ici, ils doivent d'abord passer ici. On va faire les tri avec les différents signes qu'ils présentent afin que nous puissions protéger et le personnel soignant et les autres personnels qui se retrouvent de l'autre côté.
Welcome to the flip side. Make no mistake, Ebola is one of the world's deadliest infectious diseases, with fatality rates that can reach around 50% in some outbreaks, according to the World Health Organization. And the DRC has seen more Ebola outbreaks than any other country since the virus was first identified near the Ebola River in 1976 by, among others, Jean-Jacques Muyembe Tamfum.
Le risque est très grand pour que, par exemple, la pandémie prochaine parte de la RDC. Il y a beaucoup de chances que ce soit comme ça, parce que notre écosystème est propice, n'est-ce pas, au développement de différents pathogènes. Et donc, mais le problème, comme je vous l'ai dit, c'est la faiblesse dans la surveillance. Notre système est très faible pour détecter une épidémie.
But despite repeated outbreaks, Ebola has never spread globally on the scale of COVID-19. Part of that reason is experience. African scientists, doctors, and frontline workers have spent decades building systems to contain the virus, often under extremely difficult conditions.
Là, on intervient directement. Il y a quoi souci du médicament il faut déjà stocker donc intervenir directement. Ça y est, Ebola ingine.
The new strain, known as Bundibugyo, has no vaccine. Ebola outbreaks often emerge in remote areas with weak infrastructure, limited healthcare access, and deep mistrust of the authorities. In eastern Congo, ongoing armed conflict makes intervention even harder. But despite all this, Ebola containment in Africa has also become one of the continent's most important public health success stories. The 2014 to 2016 West African Ebola epidemic, the deadliest on record, was eventually contained through aggressive contact tracing, isolation measures, regional cooperation, and community mobilization led largely by African health workers and institutions. Today, many of those lessons are being used again. Neighboring countries, including Uganda and Kenya, have already stepped up surveillance, border screening, and preparedness support for the DRC.
These countries need to be self-reliant, need to be able to learn and have the capacity to do the surveillance, and there needs to be multilateral cooperation to make sure, because these viruses don't respect borders or policies or politics.
Admittedly, the decline in development aid led by the United States has made the situation harder, but it also presents an opportunity for more sustainable disease fighting.
I'm starting to see evidence of countries who have been affected by this cut to move beyond their initial reaction, which was how do we make up for the shortfall, how do we get money from somewhere else. From that, they have evolved into, can we use this crisis to come out better? And in this instance, they're talking about sovereignty, which basically says, can we make decisions that are best for our country?
Early detection remains one of the continent's biggest challenges. But when outbreaks hit, African response systems are now faster, more coordinated, and more experienced than they were decades ago. And that matters, because Ebola control depends heavily on rapid isolation, local trust, community outreach, and tracing human contact chains, all areas where African health teams have built deep expertise.
Nous avons renforcé les mesures de surveillance sanitaire, la sensibilisation communautaire ainsi que les capacités de prise en charge dans les structures de santé. Les équipes médicales sont formées sur la détection rapide des cas suspects. Aussi l'isolement et l'utilisation des équipements de protection
Et je suis sûr et certain que cette population sera aussi résiliente par rapport à cette épidémie. Nous demandons d'être calmes mais vigilantes et de ne pas céder à des manipulations ou à des fausses informations.
The Ebola threat in the eastern Congo is serious, but so is Africa's experience in fighting it. And while the world often focuses on the outbreaks once they become emergencies, African scientists and frontline workers have been battling these viruses for decades, often with far fewer resources than those in richer countries. That doesn't mean the fight is won, but it does mean Africa isn't starting from zero. And that is the flip side.